livingfearlesslywithlisa.com. And until next week, our fearless friends, this is Al Cole from CBS Radio telling you to be your own hero, be your own shero, be your own leader, and be your own best friend.
Hi, this is Neil Donald Walsh, author of Conversations with God, and you're listening to Contact Talk Radio.
The views expressed on contacttalkradio.com are those of the guest hosts and callers, and not necessarily of this station, its management, or other advertisers.
This is contacttalkradio.com, consciousness in action, and you are taking action into your consciousness by tuning into Contact Talk Radio.
And on tunein.com, Ping.fm, and Upsnap Mobile.
Contact Talk Radio.
Welcome to What the Health, an independent approach to your health span. Have you noticed how our healthcare system may not have your best interest in mind? Join Dr. Eckel in this fun and sometimes disturbing exploration of the state of healthcare and what it means for you. Now, here's your host, Dr. Eckel.
All right, welcome back, everybody. This is What the Health, and I'm Dr. Greg Eckel, and I've got my guest on today, Dr. Sam Madeira. He's got a big mission, passion, and life work. It's to help you find the root cause of your health problems and your unique transformative path to healing and guide you to maintain a state of health and vitality throughout your life. We're really well aligned. He is a naturopathic physician. He's licensed in Washington State and in Montana. He doesn't just play an internet doctor. He is an internet doctor with 2 licensures. So welcome aboard, Dr. Sam.
Thanks so much for having me. Appreciate it.
You are very welcome. This topic is near and dear to me. I kind of want to start out with saying what is going on with testosterone and men's health and the environment. We're seeing the levels of testosterone plummet in the population in North America. What is happening here?
I think the biggest thing that people may not be aware of, or we're just literally swimming in it, is xenoestrogens and the chemicals around us in our food, air, water, home cleaning products, sunscreens, what have you. We're literally swimming in it. And I like to tell a story going back to college, where I was in a orientation course for 3.5 weeks paddling on Lake Mead, and it's a giant man-made lake. So they stock the lake with fish, and they have to restock the fish every year. So this was almost 2 decades ago now, and the park ranger said that they have to redo this every year. And he thought at that time it was because of all of the birth control metabolites from women's urine from the porta potties getting into the lake. So all the fish are turning, male fish turning to female fish. And we know this from like amphibian studies, from different chemicals that are causing frogs, male frogs, to turn into female frogs. Obviously we're not fish or frogs, but we have similar things going on with us, where testicular size is shrinking from not sleeping enough. Same thing with ovarian mass shrinking with less than 7 hours of sleep. So we have all this information now, and in some ways it's kind of like better living through chemistry that you can't get away from. We have all these cleaning products, and ideally, hopefully while boys are going through puberty, they're not exposed to too many things and not having, extreme like lead paint exposures and things like that not only mess up hormone levels, but the brain and neurodegenerative development and stuff like that you're an expert in.
Indeed. Yeah. I'm excited to talk about this because that hormone component is huge in brain health. In general, though, we're seeing this component. I mean, that is like right there is a what the health moment for everybody listening out there. Is we are swimming in it, and it is so ubiquitous that we don't even. It's hard to believe it. Like what you just said there, the water in Lake Mead is causing the fish to change genders, right? I mean, that's pretty profound statement. That it's just a granted and forgiven. Like they've got to restock the fish every year. well, we're eating those fish. We're swimming in the same sea of chemicals. When folks come in, you've got your Apollo clinics, right? That's the name of your clinics.
Correct. Yes. Yep.
And you're predominantly working with entrepreneurs and business folk really looking for optimal performance. How do you couch this discussion of bringing up the hormone aspect in addition to the environmental component that you just brought up there? How do you start this journey with people?
Yeah, well, I try to pre-educate as much as possible, like all of us do, and explain that today we have so many more toxins we're exposed to. There's other things that play into it, as you know, like head injuries, concussions. And I think the nature with both men and women today, adults, is that we aren't rewarded on being healthy. No one's going to reward you every day for getting 8 hours of sleep at work by giving you like $10 more per hour,
Right.
And no one's going to like give you a high five in the hallway if you work at a big corporation. If you're like, hey man, I got 8 hours of sleep, they're going to be like, you're lazy, So I think part of it goes back to our innate reward system, and we're rewarded with the holy dollar and with material things. And what we found is that doesn't really work out for, being happy and healthy. Like, yes, you need a certain amount of finances so you're not on the street panhandling or, lying awake in bed every night wondering how you're going to pay your bills. But after that, after the $75,000 or $80,000 income that they did in the happiness study, we find that more doesn't make us happier. And so how does that play into hormones? Well, people are working at these companies. They're working themselves, literally trading their health for their income. And that equates to not sleeping. That equates to using, quick fixes, which usually equates to a lot of medications, or at least one or two medications before age 45. And then wondering, okay, well, this didn't work, and I'm not going to go back now to my tech campus MD, who I can literally see for nearly nothing or free because the insurance and the company has set it up so it's all paid for and it's convenient, to, okay, well, now I'm going to invest out of pocket into my health. And what does that look like? So it is huge, and not just from like a health point of view, but it's a huge educational point of view of, okay, this is a different kind of medicine. And we're not just going to put a bunch of Band-Aids and duct tape over you and send you back out there to go do battle. And there's, the archetype is of the type A person who kind of sees themselves like a warrior pushing through life. And I see this with women too, especially the kind of type A mom, parent complex. So, and what happens is eventually you just get your adrenal hormones crash, your, gonadal hormones crash, and then you get symptoms of anxiety and ADD. And then you get those medications for those syndromes or diseases, which in my book aren't really diseases. Like anxiety is not a disease, it's a symptom, for example. But it seems like everybody has been diagnosed or is being diagnosed with symptoms of adult ADD where it's not like they were on the spectrum as a child, Right. So it begs the question of, do they really have ADD, or do they just have a lifestyle deficiency where they have no dopamine, they have no serotonin, they have no, acetylcholine in their brain, so they can't like hold a conversation and get their things done at work. But it really is that they can't sleep at night, and they're eating the wrong things, and they're using these household chemicals like Axe Guard spray for their deodorant, So it is a big kind of like, let's get you out of the matrix kind of moment without biting the hand that feeds them, because, they got to keep their day job. And, Dr. Bill Mitchell, who I was lucky enough to know of him and see him speak a bunch of times before he passed away. And he used to say to all of us naturopathic doctors, he was one of the co-founders of Bastyr University, for those who don't know who Dr. Mitchell is. He would say, you can't just take away something and not replace it with something else. We're not just going to tell everybody to like stop drinking, stop smoking, and go cold turkey and like good freaking luck,
Right.
So I recently heard some like prospective patients say like, oh, I thought you were going to tell me like I couldn't have any alcohol. And I don't know where you got that idea, but maybe cut back and see how you feel for a couple weeks,
Yeah.
So I think, you got to live in this world. We all live in it. We're all doing the best we can. And there's going to be nights where you don't sleep. There's going to be days where you don't have time to exercise or go outside. And we're all just doing the best we can in the end. But there's stark contrast to the person that is has very low testosterone and their lifestyle is a complete train wreck, as well as their life. Otherwise, they wouldn't be there.
Right. So what are you seeing what are common symptoms that you see coming in for low T, right? I mean, what gets advertised to us is it's all libido and erection all the time. But I think it's a lot more dynamic, right? I think as a man, I would like to say that, yeah, we're much more than just those two items. Those are quality of life issues, but what are you seeing with what are you kind of the complex of symptoms that people have that they might not even be aware is a testosterone issue?
Yeah, definitely. I mean, I think the reason why those are the ones we hear about is that, first of all, it's marketing. Second of all, from the adult aging male questionnaire, they call it like the ADAM questionnaire as the acronym, is that the two top symptoms on there that from the research that have a strong connection and correlation to low T are low libido and erection issues. However, that doesn't, if you have those issues, it doesn't always mean that it's low testosterone, or it could be. So the other symptoms that come up a lot are low motivation, just like lack of drive altogether. So sex could be part of it, but it could be, you know what, last year I got my promotion. This year I'm not going to get a promotion. And I'm actually kind of scared because I can't keep up. And I'm 42 years old now. And there are people coming in who are 24, and I'm worried that they're going to take my job. And there's this ageism in tech right now that I hear from my patients where somebody will have the experience, they'll have all the, credentials, and they'll know more. But since the company can hire new blood and pay those people less to do pretty much similar work, it's very much a fear-based kind of like lack of job security culture. So, and we have a lot of tech companies in Seattle. We have all the tech companies they have in Silicon Valley, pretty much like all the big ones, Google, Facebook, Amazon headquarters is here. And, they're making good money, but it's for them, it's more about, well, I don't really have job security. And when you have that kind of fear or that monkey on your back all day long, you're not going to be making androgens. You're not going to be making adequate DHEA. You're going to be in fight or flight every other minute with your manager or boss and kind of looking over your shoulder, wondering like, is this enough? And I've literally heard my patients say, if I work 11 hours or less per day, I'm considered a slacker. So if that is the work climate, or in the tech startup world, it's even, that's the tech startup world. So if that's the expectation, then it's literally like performing like a Olympic athlete without getting the rest of an Olympic athlete, Yeah. And most Olympic athletes, I just was educated by, I was just talking to Dr. Kirk Parsley, who's the sleep expert doctor. And he was saying most Olympic athletes get 10 hours of sleep at night, roughly. So if you're going to be in this high performance demand work culture without a job security, and with things in place that are basically there to make the company a lot of money, but make you feel like you're expendable, and then it's not like my grandparents' generation, like the World War II generation, where they had a career for their whole life and they were like, the mad season generation where they're like given all these pensions and they have so much job security and they just keep going higher and higher and there's some comfort. That's not the world we live in anymore. So where where it comes into play is, I think a lot of it is just fight or flight, and people are kind of almost immune to it. And I literally hear men who are in this tech world say to me, I just want to go home, be in a quiet room with the lights off, no sound, nobody around me, and either like punch a punching bag or scream or just have nothing, like nobody ask anything from me. I don't want to socialize. And I kind of see it like, it's kind of like a work battle fatigue, you know, where there are these expectations from the top down. And ideally, you know, we would have work cultures, and there are some, you know, I think some great companies out there. I'm not going to name names or anything, but I think there are some great companies out there, and great, you know, it depends on your manager, some great teams and leadership that are doing good things by people. But, you know, that's not what we're talking about. We're talking about people who come to see us who are struggling. So, and I also think it takes a lot of courage for men to say, you know what, this isn't working. I'm going to go ask for help. I'm going to go to this naturopathic doctor who I know nothing about. They're, you know, Dr. Madeira is not taking my insurance. Like, how the hell is this all going to pan out? And how am I going to trust this person? I don't know them. I have no context. I'm just getting my buddy who I go and, like, we go to jiu-jitsu together and work out at the gym occasionally and have a couple beers here and there, and trusting, you know. And men and women definitely speak different languages as patients. So, you know, I think a lot of the low T, going back to your question, is about motivation and about what the man wants to get out of their improvement. So for some guys that could be like, hey, I run a CrossFit gym and I'm an entrepreneur and I'm not getting the gains I used to get in the gym. And I'm actually, it's not going to look good if I can't teach a CrossFit class every night. So it really just kind of boils down to what's going on with them. So I do hear muscle strength and endurance being an issue, especially for men age 40 and older. And a lot of it is insulin resistance, or the beginnings of insulin resistance, like pre-diabetes. So we can do these more kind of like advanced cardio metabolic lipid testing, and there are these markers that can find out, okay, you have the beginnings of insulin resistance and metabolic syndrome. And sometimes you can look at these people and walking in the door and you can say, oh, they definitely have insulin resistance or metabolic syndrome. So yeah,
Got
there
it.
you have it.
Awesome. Yeah. Thank you for that. You know, it is, you know, a lot of times folks aren't thinking about that, but we've got heart health, brain health, in addition to the hormone balance. And it, like you brought up, the whole diet component and diabetes and insulin resistance tied in also to hormones. So it's not just, you're not just giving people testosterone, right? You're probably, if I guess what you're doing full naturopathic care, like treating whole dynamic beings, and, you know, you're addressing their diet and their exercise and their sleep and their relationship community aspect, in addition to the lab panels and, you know, all of the other components of testosterone as well. Is that right?
Very much so. Yeah. Actually, I think a lot of people come to me because they think that we're going to just work with testosterone, and they're like, well, how much does the testosterone cost? I like to tell this story because it happened recently, where it was probably one of the busiest days over the last month. And I had a gentleman call and then text me, because I text through an app on my phone. And he wanted to get testosterone therapy. First of all, how do we know you have low testosterone? Do you have blood tests? Do you have urine tests? Do you have a saliva test? Did you self-diagnose yourself on some quiz online that's inaccurate? So second of all, you got to go with diagnostics first. You need basic blood work. You got to make sure before someone gets testosterone, especially testosterone injections or pellets, that they don't have any clotting factors. And most doctors aren't doing this. They're not checking for prothrombin. They're not checking for factor Leiden 5. And you get that person sewed up with some pellets in them, or you get them on injections, they're going to throw a clot, have a pulmonary embolism potentially, and end up in the ER and maybe die. So yeah, that's genetic, and that person shouldn't be on testosterone testosterone therapy, definitely not injections. And if they are, it should be a cream, and they should be on warfarin or blood thinner. So we got to check off all the boxes. Like your PSA isn't above 3. You don't have prostate cancer right now. You're not about to like fall over and have a heart attack. You're not like stage 4 heart disease. So all those things got to be checked off, along with like, are you willing to do the lifestyle stuff? Are you going to go to bed, at a decent hour and aim for 7 to 8 hours of sleep at night at least? Like, are these reasonable things for you to do? And then are you going to inject at the prescribed dose, or use the cream at the prescribed dose? Or are you going to try to overdose and abuse this DEA controlled medication? So actually, I would say I do probably more than most doctors as far as like making sure this person's not going to die with this prescription. So
I'm sure they appreciate that, Doc.
Yeah. Because then we're in another what the health moment. The patient's in the ER, they got a pulmonary embolism, and they're like, what the hell? And then their ER doctor's like, give me your list of medications. And they're like, oh, well, there's the testosterone. So this guy who texted me, going back to my story, he said, well, how much does it cost? And I was like, I don't know how much it's going to cost. This is how much it typically costs for everything for a year. I don't know what you need though. And then he said, well, I'm a snowbird. I'm going down to California, Arizona. I don't know exactly. I don't remember where he was going in a month. And he's already there now. And he said, I'll go to Mexico to just get my testosterone. So for the people listening, the reason why I tell that story is I hear a lot of guys saying, well, my personal trainer got me some testosterone in his gym bag. And these people are like making their own testosterone in their kitchens and stuff. And then injecting
For real?
it. Yeah. Yeah. And then they're flushing the needles, or trying to flush the needles down the toilet, which is also pretty scary.
Wow.
So yeah, just some wacky stuff that I've heard and out there. So if you're doing that, just cut that crap out. Go get a medication that's from a compounding pharmacy that, you can trace the lot number back and make sure that you're not going to get sepsis from injecting yourself. So it's a DEA controlled medicine for a reason. It's not something that you should just be treating like B vitamins,
Well, I didn't realize people. So really, that's like in gym culture, or like in the culture, people are just making, like in their kitchens, making testosterone. I mean, how much does testosterone, 10 milliliter testosterone cypionate, 200 milligrams per milliliter? That is not a very expensive medication.
Less than $50, probably about $40
per month for very well-dosed, metered medication. Like, don't mess around with that.
Yeah. It's ridiculous. And it's not worth getting sepsis and like getting part of your body cut off.
Geez. Yeah, no. So what are you seeing? What are the most common pitfalls? I mean, don't make it in your kitchen table. Don't take it from your personal trainer at the gym. Let's go to a licensed professional and really get a proper workup so you don't die of a heart attack or an embolism. What other, like in the reasonable person's mind, what do you see as like common pitfalls? Because this really is, I mean, we get, we're inundated in Portland, Oregon over the airwaves on all the sports talk radios about low T, and, you can order sildenafil on the TV now. You go to the men's clinic and get your testosterone, and basically that's what they're doing, right? So what are pitfalls? What other pitfalls are you seeing with this whole kind of hormone replacement, bioidentical hormone replacement, etc.?
Yeah, great question. I actually used to run a so-called low T clinic. It was a men's clinic in Western Washington. And I would drive it felt like I was driving down towards you in Portland, Oregon, because I would stop and work in Federal Way. So it's, you're pretty far, you're past the SeaTac airport from Seattle. And then I would go the opposite way 2 days a week to Linwood. So I did that for a while. I was at that clinic for a year, and, I'm a loudmouth, so that's why I have a podcast. And I basically didn't agree with a bunch of stuff they were doing there. They were starting pellet therapies, and this was back in 2014, and I wasn't really down with pellet therapies, still not really down with them. And, I think it's great for maybe some people. Like if you're just never going to apply a cream and you're never going to do an injection and you're just that kind of guy, you're too busy, they're probably good for you. But Yeah, so the pitfalls being that I literally had to fight with one of the co-owners of this clinic. Probably like a 45-year-old man came in. I don't remember how old he was. Let's just say he's 45, roughly. And he had great testosterone. Like his testosterone was like up in the upper quartile where you want it to be. And it wasn't too high. It was great. And he wanted me to give this man testosterone to make the clinic money. So I think that's the first problem with these clinics, is that they are not geared towards your best interest. Where when you hire like a private doctor like myself or yourself or some of our colleagues, you're hiring somebody who is always going to have your best interest. And it's not so much like, yes, obviously every business wants to make money to, stay afloat, and we all deserve a certain, I believe we all, if we're going to work for it, we deserve a certain lifestyle after we work for it. But with that aside, these clinics, I was rubbing heads with, because I was in management, I was rubbing heads with the people running them. And eventually I left. I was actually asked to leave because I wasn't falling in line with the company culture. Talk about toxic company culture.
Yeah.
So I think that's the first problem with these clinics, where you have people there that are getting paid to get you on testosterone therapy. Now think about that. Like, let's think about that, where if you went to a hospital and somebody was always going, and this is actually how some hospitals are, they make money off of procedures. They make money off of procedures. So they're going to make money. They want you to get a procedure while you go in there. It would be like going to the dentist and being like, well, it looks like you're starting to get a cavity. Let's just drill like 5 of your teeth every time, So that's the first problem. The second problem is they're not doing screening tests besides like a PSA and a CBC, and hopefully they're doing that. But there is a clinic up here in the greater Seattle area, and they are just doing like 1 lab test a year, or 1 or 2 a year. And that's dangerous, because if their red blood cell count goes up, you don't know if they need to decrease their dosage. Usually cardiovascular exercise will help with that, or potentially even donate blood, which some guys need to do. So, and it's genetic too. The way people's red blood cell count goes up with testosterone is a genetic thing. So basically, long story short, and the other thing is people are over prescribing anastrozole. So anastrozole is a aromatase inhibitor. At much higher dosages, it's used for women with estrogen positive breast cancers. So if you Google anastrozole or Arimidex, you'll see, chemotherapy drug. It's not a chemotherapy drug. It's used when women are also on chemotherapy to block aromatase. So aromatase takes testosterone and it converts it to estradiol, estrogen, your most potent estrogen. And for men, when you're on testosterone therapy, if you take a man that has insulin resistance, they have that 40-inch plus waist, their BMI is really high, and they meet all those parameters, they're automatically most likely converting their testosterone to estrogen. And then there's genetics too that push that pathway. So, and you just give them testosterone at this low T clinic, they automatically give every single man aromatase and HCG. And the HCG, I would argue, is a good idea, but not every guy needs to be on it right away, because it's basically replacing your luteinizing hormone by stimulating the testes to make testosterone inside the testes and prevent testicular atrophy the best they can. So not a bad thing, but it shouldn't be used all the time, so it should be taken away for a couple months or a month and then, introduced again. So these low T clinics basically have like this cookie cutter method. And that's what I learned. And then I started questioning things like, why are, 30% or 20% of my men not benefiting from this after 3 months?
Yeah.
Like that doesn't make any sense. Their labs look good. And I'm talking to this guy on the phone and he's saying, nothing. I have no benefit. I'm right back to where I used to be. What the hell is going on? So I mean, you can have genetically hyper secretors of testosterone where they have like these genetics. I won't get into all the lingo because it gets pretty complex, but for the listener, basically you can have genetics that are basically you could be synthesizing enough testosterone, but the issue isn't synthesis from your testes and a little bit from your adrenal glands. The issue is that you're just getting rid of it really fast, you know? So you got to work with somebody who's like willing to do that deep dive. And the other thing about testosterone therapy, even if it's low dose, eventually you're going to shrink the testes. You're going to decrease your ability to make enough testosterone. So if you start with botanical hormone replacement therapy in your early 30s, you do it for 10 years and you come off, it's going to be really hard crash if you're not working with somebody to say, okay, this is how we go off this. These are the herbs we need to replace things. You need to do HCG and maybe even consider Clomid for a while. So I just think that there's not, in that model, we are seeing 30 patients a day sometimes. And if you're a health practitioner, I've talked to MDs and they're like, Sam, that's a lot of patients. And so for the listener, that's a lot of patients. Like, that's too much, I think, to give quality care. And you basically feel like you're throwing testosterone French fries at people in a fast food place. So like they have the money to do the advertising, and I think it's dangerous to prescribe or let people buy sildenafil off the internet or TV commercials. Why? Like, my question is, why does this person have erectile dysfunction? Frankly, maybe they need a new job and a new wife. Like, maybe there's no trust in the relationship anymore, and they need to go see a sex therapist and figure out if that relationship is a toxic relationship or not. And maybe it's not about testosterone. Or the other thing that I've seen more recently on the more physiological side is autoimmune diseases in men. So like Crohn's disease, there's a lot of type 1 diabetes, but more shockingly, since it's statistically not that common, is Hashimoto's thyroiditis in men. So we're seeing that. And I've talked to some colleagues around Seattle, and we're seeing that more and more with male patients. And it's like, man, if you're going to want to chug IPAs 4 days a week or 6 days a week or 8 days a week, and you're going to eat whatever you want, and you're not going to exercise that much or be a weekend warrior, and your gut health is crap, and you think like you have an iron stomach, but you don't, like having liquid bowel movements, dudes, is not healthy. I mean, I remember being even a student clinician, and I was amazed when talking to male patients, like, so what's going on with my bowel movements? And they're like, it's all good, dude. I'm not going to talk about my poop with you. And it's like, well, no, we need to know about that. Like, I'm a naturopathic doctor. We're big on the BMs, but long story short, I think there's always room for improvement with men's health. And I think men are being disserved by thinking that they need to be like a walking boner and just throw sildenafil or tadalafil at them and testosterone. And if they aren't producing dopamine, which has a strong correlation and connection with testosterone, the motivation neurotransmitter, then they're not going to be motivated to do the lifestyle stuff. So it's like, you got to tune up, and you're a brain doc, so you got to tune up the gut brain axis. You got to work on all things. And you have a hyperbaric chamber in your office, and I think that's awesome, because there's so many guys that have had multiple concussions, whether they're playing high school football or multiple car accidents, etc. Maybe they fell and slipped on something that didn't look like ice, and it was icy in a winter in Portland or Seattle, and hit their head. So long story short, it's like, what the heck is the root cause? It's basic naturopathic principles applied to hormones. Like, what is really going on here? Why does this person have no sex life? Why does this person have zero libido? Like, what is the climate, the environment that they're in every day? And would you want to be in that environment? Would anybody want to be? Could anybody be healthy in that environment?
Sure. Oh, I love that. So I'm going to take a quick station break. This is What the Health. I'm Dr. Greg Eckel. I've got Dr. Sam Madeira on the line here. Am I pronouncing your name correctly?
Yeah, Madeira.
Madeira. Perfect. Yep. I got it. And we're talking hormones. And if you're just tuning in, go to Nature Cures Clinic, hit the podcast tab, and listen to this show. It's great. Please share us with your friends and your family. You are getting information here that you aren't getting elsewhere. Dr. Sam is a hormone expert and a naturopathic doctor, and he treats people, not just low T, not just a lab. And I think that really is the main just of the point that you're bringing up there is, you know, a lot of physicians are just treating lab work. It's like, oh, well, what's your T level? And let's get that there. Let's look at your estrogens. Maybe now you're on, you know, HCG and Arimidex or DIM or, you know, something to stop the estrogenation, but they're not really addressing everything, the full completeness of a human in front of them, right? I love that is your approach. And so I want to unpack a couple of those things because this is like second nature to you. And so this is the pieces that I want to start with are, okay, mode, you know, you talked about creams and you talked about injections. And do you, over your experience, because you really are an expert on this topic, do you have a preferred method? You mentioned a couple different reasons if somebody has some clotting factor disorders or to maybe go on creams versus going on injections versus the pellets it didn't seem like you were really into. So, you know, I will share in my practice, I started with I actually never did bioidentical hormones. So I'm going to admit this on the air with you, Dr. Sam, I would thought, you know, look, these are natural transitions, in particular for women going through menopause. And I had Dr. Jonathan Wright literally kick me in the tuchus and said, do you promote death in your practice, Greg? And I thought, he said, well, that's a natural process. So, you know, what you're talking about, you know, we could really help quality of life. So 2 decades into practice, we are supporting people. I've got 90-year-olds that are healthier than when they were 60. So this is really a big deal. Like we're talking quality of life and longevity. So that wind up that I just gave you there, you know, have you found preferred methods and why of testosterone?
Definitely. So I guess my background started out mostly in injections, and I do use cream, and I have used cream here and there. Cream I would say they're both a nuanced approach, because if you're not dosing, if the potency of the cream isn't enough, so usually you want to see like 100 milligrams per like half milliliter or something like that for men, and getting them a dose of like 150 or 100 to 200 milligrams per day in the cream has been shown actually out of Moses Lake Compounding Pharmacy. And keep in mind that they're a compounding pharmacy. They're not a large pharmaceutical company. So they did a study, and it was an N of 1 study, but they did take blood every few hours, and they did see a good rise in testosterone that stayed steady throughout the day. With injections, I usually recommend, if somebody can do it, every other day injection. However, if you think about that, who are the people that are coming in to our clinics? You know, usually these men are so busy, you know, kids at home or wife at home, you know, dog, job where they're having to work 10-hour days or whatever, 10 to 15-hour days. They are not going to inject every other day, you know?
Yeah, no way.
So I usually start people out at once a week, and then at about 4 to 6 weeks in, we switch to twice a week. And so you split the dose in half. We're not doubling their dose. That would be crazy. So we usually do injections every 3 to 4 days. So like a Wednesday, Saturday. So you'd inject Wednesday morning and again Saturday morning, or like a Tuesday, Friday. So then they want to get their blood draw on the morning before they inject. So you're not getting like a false spike. And then usually I pick the blood draw to be 4 days apart. Otherwise, if it's 3 days apart, usually it's kind of like a false elevation, and then you're going to be decreasing their dose when you don't need to. And yes, they're going to get a spike. They're still going to get a spike in testosterone in the day they inject, and then they're going to start decreasing in amount of testosterone. And what we're looking at is the lowest amount of testosterone that they're going to be getting in that bucket. And, ideally someday we would have something like a testosterone pump, like we have an insulin pump and technology where it would be, like an implant or something, like a small implant. And then instead of pellets, it would be dose dependent on the person's like body weight, age, lab values over the, like maybe you would get like 4 blood draws over the course of like 3 weeks or something, and then average out their total testosterone for that 3 weeks, and then give them an implant or something. So if anyone is listening, wants to do that, just,
there's a market for it.
Yeah. So I think that the long story short, the technology for testosterone is good, but it could be improved significantly. Pellet therapy is a minor procedure. So you want to make sure you're going to somebody who knows how to use a scalpel, and that it's in their legally in their wheelhouse, like they're allowed to do that with their license. So you make an incision, usually, ideally, it's like right kind of where on like a Levi jeans or jeans, the top of the pocket would end. So like that fabric ends. So obviously you're not going to cut there, but that's like the landmark. And then they would make a small incision that's like maybe a centimeter or so. And then you use a device to shove as many pellets as you're supposed to into that tissue. You're not supposed to bike, like road bike, mountain bike, run, no squats. So like you can't go to CrossFit class, you can't do any Olympic lifting, no jumping jacks, no long periods of sitting. So if you have a desk job, that might cause some aches and pains there. And you can't be on a long flight because they could pop out and protrude. So there's a lot of kind of anecdotal stories where people have had infections. I have a colleague who does them in Seattle and Bellingham, and I've talked to him about it. And he said, I've never had anybody with an infection. So he's really well versed at this. So I refer people to him. And usually people get this training at a company down in Texas, and I think they're like the gold standard. So they have doctors do these weekend trainings, and then they start doing this. The reason why pellet therapy is so popular right now is that it's a procedure. So in medicine, we are usually paid as clinics by procedure over our consult time, over our brain. So, and then, there's a time and place for all procedures, I think, in medicine. So whether it's a surgery or, IV therapy or hyperbaric chamber or pellet therapy, I just think that's kind of similar to the low T clinics, that the pellet therapy is probably being overused. But I like the injections and creams, and transscrotal application for the cream. And then Jonathan Wright is really big on like applying like DHEA creams and testosterone creams to the anal mucosa, because it's really easily absorbed there. So I usually say, apply some to the scrotum, some to your butt right after you get out of the shower, and then wash your hands, and you're good.
Yeah, cool. Well, and those are the predominant routes. Do you have some cutoff for numbers for lab? Like what's a typical lab panel? Like you're doing extensive workups on your patients. What do you see? Do you follow like Terry Hertog's value numbers, or do you have your own, or what are you doing for, we just recently, for folks that are watching, testosterone levels in the major labs around the country just fell 300 points. Used to be 1,200 on the top end, now they're down about 900. That does normal common lab values. There's nothing normal about it, but wondering if you have some ideals doc, on your panels, what you run, and then your recommendations off of there, like whether it's herbal therapy or anything like that.
Sure. Yeah. So usually I like to see people's testosterone 600 or 650 and above. And I'll say why in a second. I love Hartog's book. And I've seen him speak at A4M years ago. Brilliant guy out of Belgium. And so he says 700. I think 700 actually is too low. Ideally, it would be 800. But with lifestyle and diet, you could get it up 200 points. So I don't want, if someone has like 650 or 600, I don't want to shut them down with testosterone yet. And, for the listener, when exactly like you're saying, when I started in 2013 doing, ordering thousands of labs on men, seeing 15 to 30 patients a day, we would always test total free testosterone, sex hormone binding globulin, PSA, CBC, and estradiol. And, I would say that's a bare minimum, and I obviously do more than that now, but you want a certain amount. You want like at least 20 nanograms per deciliter free testosterone. 25 would be great to 35. I believe that's Hartog's number. And then recently, I would say 800 to 1100 would be like the golden ticket, if someone could get there. Most guys are not there though. And so once they fall below 450, then I say, with lifestyle and diet, it's going to be, unless they have sleep apnea. So if they have sleep apnea, then I say you need to get a sleep study if you haven't already, and use a CPAP. If you're not using your CPAP, use your CPAP, or you're not a patient, because they can die, and it happens. So I have seen, I had a patient who had undiagnosed sleep apnea. I said, go get a sleep study, got a sleep PAP machine, and they brought their testosterone. I don't remember the exact starting number. I think it was 350 to about over 800. So, and that was about 4.5 months with herbs, because they didn't want to do testosterone therapy. And I was, I wasn't 100% sure that was the best thing for them anyway. So the herbs that I use are all MediHerb, and I have a podcast where I interviewed Carrie Bone, who's written a lot of textbooks that we use in naturopathic medical school and well-known internationally. And in Australia, medical herbal products are reviewed and regulated by their version of the FDA, and their version of the FDA is not nearly as corrupt as ours. So good for them. And good for us, because then we can use these products that have much higher standards than 99% of the stuff on the shelf out there, even the stuff that you can buy from practitioners. So I use MediHerb tinctures or tablets. If somebody, or Gaia herbs, and those are the herb companies I like to use because of their quality. So basically, herbs aren't being dosed high enough to move testosterone. So I have like an N of 1 study I did with a guy before we put him on testosterone therapy. He was traveling every 2 months from India, Chicago, London, Austin, Texas, back to Seattle.
Wow.
So multiple time zones, multiple continents, low testosterone, didn't completely change lifestyle, still smoking, couldn't stop smoking, tried biofeedback therapy that didn't help him. I guess, it's a hard thing to deal with. But anyway, his testosterone went up about 56 nanograms per deciliter total testosterone with multiple herbs, tonic herbs at pretty good dosages.
Cool.
So herbs can move it. And yeah, so those are my numbers usually. Yeah.
Cool. The, under all-cause mortality under 300 is higher. So that, for me, that's like a critical motion of like, okay, we're not going to do botanical medicine at this point. We've got to go right to a bioidentical component. But up to about 450, I definitely recommend the lifestyle and herbal support if we could do it that way. So that's really encouraging to hear, like very similar experience for you as well. So what about estrogen blockers? So what is happening there? Overprescribed, you said the HCG, you think that is a good move. Arimidex, DIM, pitfalls there. I mean, what happens for me is my patients get online and they start getting into gym culture and weightlifter culture, which is not health culture, right? And so they get skewed, and a lot of them know, like, okay, I know I got this from, this weightlifting site, and I know those guys are kind of doing weird doping stuff, but it is, more and more, a lot of men are turning to that. And that is not health promoting, but they're getting the information there. So what have you seen in your clinics, or like maybe give us some stories of some folks that you've seen some kind of maybe some faux pas out there?
Yeah, bodybuilding. So bodybuilding is really bad for your testosterone because they're using multiple types of testosterone. They may be using a couple different bioidentical ones like testosterone propionate, testosterone cypionate. They may, and things like nandrolone. So nandrolone doesn't help the other cells in the body. It's just stimulating working on the receptors in the musculoskeletal system. So it's good for guys who want to get really cut up, but it has serious side effects. And the other thing with the gym culture is that they believe in cycling. So what that means is they'll do like 3 months on, 3 months off, or like 4 months on, 1 month off or something. It depends on who you read and who you follow. And I'm obviously not into that culture, but I've worked with patients who were bodybuilders, and then they came to the low T clinic and they were like 27, 28 at the time when they started coming. So I had to review their chart before they came in. And their starting testosterone as a less than 30-year-old male who otherwise looked healthy and jacked was like 365 or something, like less than 400. And then the other thing is that there's research showing that at 450, even at 450, there can be the beginnings of destruction of the endothelial tissue in the penis. So the beginnings of like cardiovascular destruction in the penis, causing irreversible erectile dysfunction. So the vascular system and the hormones go hand in hand, and testosterone helps with vasodilation and things like that. So I think that the gym culture, the main thing with the gym culture, like you said, is that you either can have like a strong man, or you can have a man that's going to live a long, healthy life. So it's kind of like eventually in your adult male life or female life, you have to make a decision. Am I working out for health? Or am I working out because I want to be the strongest guy in the gym and then compete? And this is like my job or my part-time job. And that's fine if you want to be like the next Arnold. But what we know from the research is that the longevity people are doing like fasting like crazy, calorie restrictive diets, intermittent fasting, 2 days of fasting a month, and they're living to like 100 or something. And then you have this guy who may die at like 60, but he'll be jacked. So you just got to decide, like, if that's what you want to do,
right?
Do it safely though. Yeah.
And understand what the repercussions are for long term. I think most of the listeners here on What the Health are into longevity. They want to live a health span, is the way that we're talking about. And, I'm really about promoting healthcare that gets us to thriving. And, so this bioidentical discussion is really key for, longevity front. We're not going it for the Arnold Schwarzenegger or the bodybuilding culture. Just wondering though, like what you've seen with the Arimidex and or DIM, any side effects or cautions for folks out there watching?
Yeah, so Arimidex trashes HDL. So I've seen it just tank HDL, total HDL cholesterol in the body. It also I've been on like webinars with doctors who are talking about it causing hip fractures and otherwise healthy, like 40-something-year-old men who are really like working out hard and doing all the right things. So bone mineral density issues. So those are the top two, HDL and bone mineral density with Arimidex. And then HCG, there aren't really any side effects that I've ever seen, except for like maybe if someone did the injection wrong. You should be using that off and on though. You shouldn't be using HCG like every week. And the dosage, you only can utilize like 500 to max, I think 1,000 IUs of it in your body at a time. But you could dose higher. So you're basically wasting it if you're dosing higher. So I usually don't go too high on the dosage with that. And then Clomid has side effects because it stays in your body forever. And it can trash your libido. So it increases sex hormone binding globulin and drives down free testosterone. And that's your testosterone you use. So your cells don't get any testosterone, even if it's increasing it. It also works on your brain level. So any drug that works on receptors in the brain, I'm really skeptical of using too much unless absolutely necessary.
Yeah, that makes sense. Yeah, I like that and appreciate that caution. So last minute of the show, any final knowledge bombs or insights that you'd like to share with the listeners of What the Health?
Yeah, I think one that I learned from Kerry Bone on my interview with him is that they've found in the research that 4 grams of ashwagandha, Withania somnifera is the Latin name, can increase muscle strength. So that's pretty cool.
That's awesome. Yeah. Love the herbal tip. Well, Dr. Madeira, thank you so much for coming on and sharing your information with our viewers and listeners. Again, this is What the Health. Please share us with friends and family members. Go out, give me a 5-star review if you like what you're listening to here, because this is how we get the word out, folks. Thanks for tuning in. We are live every Tuesday from 2 to 3 Pacific Coast time. So thanks again.